Good morning, everybody. It's Dr. Eric Balcavage. We're back for another edition of the Thyroid Answers podcast. And with me today is Dr. Erica Riggleman. Good morning, Dr. Riggleman. Looking lovely as always. And we have Dr. Joel Rosen from Boca Raton, Florida. And Dr. Joel Rosen is a ninja master in helping people recover from adrenal fatigue. Okay. So we got Dr. Joel here. He's going to give us a little background about himself, and then he's going to talk to us about adrenal fatigue, what it is, what may cause it to occur, and then we'll talk about things you can do to help yourself before we finish up today, okay? So Dr. Joel, thank you so much for coming on the show today. How are you?
Great, Eric. Thank you so much for having me here. I'm really excited to do this with you guys today.
So we've known each other, I think we've all known each other for probably at least 10 plus years, right? And over that time frame, we've all kind of evolved and gone in different directions a little bit, all working on functional medicine. But you've really focused on adrenal fatigue as kind of your primary niche that you're trying to help people with. So can you give us a little bit of background about you, and then can you talk to us a little bit about what adrenal fatigue actually is?
Sure, absolutely. So, I was born and raised in Toronto, Canada. That's why I kind of sound like I have a funny accent. But I went to school in California, and the exchange rate from the Canadian dollar to the American dollar was really, really impactful. And so suffice it to say, I graduated with over $200,000 worth of student debt. And by the time I graduated, my wife was pregnant with twins. And so we moved to Florida after going to school in California, and I just crashed. I mean, I injured my back on top of that, starting a new practice, and I was exhausted and I was fearful, and I really couldn't get out of bed, brain fog, concentration, anxiety, overwhelm, and just crashing in the middle of the day, relying on stimulants like coffee to just power me through. And it was a fearful thing. So I actually had a patient who was an acupuncturist, and he brought in the book, Why Do I Still Have Thyroid Symptoms Even Though My Blood Tests Are Normal? I'm sure you're familiar with that.
Yeah.
And believe it or not, lo and behold, I opened up the chapter on adrenal fatigue, and I don't know how they got the picture of me in there, but my picture was in there. And I had never heard of it. I honestly had never heard of it. And here I am. An exercise physiology degree, psychology, a second degree in psychology, just graduated from chiropractic college. And it was like an epiphany, Eric. I just said, what the heck is this? I got to know about it. Why don't I know about it? And then it just started that whole journey of getting myself better. And then it became a mission of mine to help disseminate information and help people that were in the same boat and have no idea that there's this whole phenomena out there that most doctors don't talk about.
Great. So can you give the listeners a little bit of a background about what is adrenal fatigue? I think there's some confusion. Does it really exist? Is it just a general term like, hey, everybody's got back pain, got sciatica? Can you give our listeners some background on what it is?
Sure, absolutely. So there is a lot of controversy with it, and I think it's because it's the actual terming of the condition, adrenal fatigue. So in traditional the allopathic model, they'll do an ACTH test to test for the adrenals being specifically fatigued, meaning they'll give you a pituitary hormone, and then they want to see the impact of the adrenals. Are the adrenals going to release their main hormone, cortisol? And if you stimulate the gland and it doesn't have an adequate response, then that's the definition of an adrenal fatigue patient, and it's black or white. And it's actually an Addison's phenomena where there's an autoimmunity where your gland is destroyed and it can't produce an output. But you just like, in a lot of ways with the medical model, there's no shades of gray. And they don't look at a lot of the other things that impact the functioning of that adrenal. So ultimately what happens is there's that feedback loop. As you know, in the thyroid, the hypothalamus, the pituitary, and the thyroid, the hypothalamus, the pituitary, and the adrenals, there's a feedback loop there. And it's based on a circadian rhythm. It's based on how well does the hormone get manufactured, how well does the hormone get released and taken into the cell, how well is the cell membrane, what's the quality of the hormone, Is the feedback loops working properly at the different times of the day? So there's just so much that goes into it. But in a nutshell, what happens is the adrenals from stressors, inducers of stress, whether it's blood sugar control, inflammation, stress from psychosocial stuff, pathogen stress, chemical stress, toxic stress, anything that can be termed as a stressor to your body is going to impact the adrenals, and they're not going to necessarily fire or going to have a great quality or get into the cell effectively or broken down effectively, so that the stress response is not working properly and ultimately leads to a whole array of different symptoms, mostly fatigue, because it's called adrenal fatigue, but also blood sugar imbalances. Then we see a lot of overwhelm, anxiety, focus, concentration, not being able to concentrate, get through the whole day, even motivation. All of that can be linked back to the stress response system. And that's where we call it an umbrella term of an adrenal fatigue.
And I find it interesting, a lot of those symptoms could be a wide spectrum of different conditions. As a practitioner, how do you decipher between, is it adrenals? Is it thyroid? Is it just you're overworking yourself? Is it an immune system issue? Or is it a combination of all of them? How do you sift through all that?
Yeah, that's a great question, Erica. So I've kind of come full circle. I was really mad when I found out that I had adrenal fatigue, and doctors were denying it and looking at me like I'm crazy and saying there's no such thing as it. And so I was on this mission, like I mentioned, to discover all about it, know the ins and outs, and become the ninja on it. But the more I realized that they were kind of right for the wrong reasons, in the sense that it goes so much deeper than the adrenals. At the cellular level, as you guys know, it impacts the way that we produce energy. And ultimately, just like the medical model, if you're looking at it in terms of a cause and effect and trying to be reductionistic and say, okay, you have high blood pressure, take this high blood pressure pill, or you have high blood sugar, take this low blood sugar pill. It's a very reductionistic model. So I guess to answer your question, it's all of the systems involved in the body that get impacted by stress. Ultimately, the adrenal system is the warning signs, but the cell itself gets impacted at the ability of it at the mitochondrial level to respirate properly and to be able to produce ATP. So all bets are off when that happens. You can have focus problems, you can have cognitive problems, you can have endocrine problems, immune problems, GI problems, liver problems. And it really depends on where the weak link in the chain is and all the surrounding variables that created that in the first place.
And I 100% agree with your kind of thought on it. What I find challenging when patients come to me is that they have heard of adrenal fatigue and they think, well, I need to support my adrenals. So they just type that into Google, supplements for adrenals. And, they come in on a whole laundry list of adrenal supplements and they're still fatigued. And so making them realize that it's more than just the adrenals, it's this whole kind of picture, and, which kind of leads to testing. I think it's very important, there's different supplements for adrenals for different reasons. And so I find that testing is very important. Do you do testing, and how important do you find that?
Absolutely. So, you guys know there's great outcome assessment forms that can quantify it almost better, as you know. It can quantify better systems in the body, from thyroid to liver to GI to hormonals to, so I use that as a major tool to try to see the overall clinical picture. But ultimately what I do is I do all three testing tissues, so to speak. I do a urinary test through the Dutch test. We do a basic hormone test through the blood work, and then the saliva test. So I do all three of them. I make sure every single one of my patients do all three, and then we do a before and after, because the best test is the follow-up test. Mm-hmm. So each one of them tell us a little bit of a different insight. It's like looking at a plain film X-ray. You can't get just a head-on view and say, okay, there's nothing there, because if you look from a different angle, you may see a crack in the bone that you didn't see, from the other angle. And that's kind of the analogy you see when you look at a urine, a saliva, and a blood test, they all give you great indications that the other one doesn't. A lot of people rag, especially in the alternative medicine world, that, oh, blood tests are useless. And I don't find that to be so. I find that it really gives you a great absolute value, tells you about the binding capacity, tells you about the pituitary hormones, and can give you great insight. Saliva, is great because it can really correlate well with the circadian rhythms and let you know about the free fraction of the hormone. And then, my favorite is the Dutch test, where it can really look at the metabolites, the end products, the breakdown products, how methylation is involved with that, phase 1 and phase 2. So all of them are great. The only thing I'm missing is hair, and I haven't gone down that rabbit hole yet, but that's probably next.
Okay, yeah, and I know some people really do a lot in favor hair analysis. I haven't done a lot down that pathway either. I'm not quite certain there. I'm not sure how much Erica has done with hair analysis, but I know there are some that really put a lot of they take a lot from hair analysis. I just haven't gone that route either. But what I want to do is kind of focus on a couple of things that you've said so far. One of those is the difference between the medical model and the functional medicine model, and the difference really being that in the medical model, it's disease focused, right? So it's if you either have a disease or you don't, right? And in functional medicine, the reason we come up with a different diagnosis is because we're looking at it from functionality standpoint. How well is the system working, right? Versus it doesn't have to be diseased, it can just be dysfunctional, right? Is that safe to say from your standpoint?
Oh yeah, absolutely. That's I can't say it better than that.
And if you look, and when you're talking about doing blood work, if a patient is getting blood work ordered for adrenal testing, what are some of the key tests that you'd be ordering from a blood standpoint?
Well, a lot of the times, we get so sophisticated as I want to look at the newest marker. I want to do what other people aren't doing. And, basic comprehensive blood work is essential. If you're looking past the oxygen capacity of the cell, which we just mentioned, that's what's at the ultimate level, fundamental level, what's going on, then, basic blood work. But it's not so basic, right? When you see people come from their primary and they don't have basic things like vitamin D, or sometimes they don't have uric acid or ferritin, or they don't have homocysteine, so I wouldn't necessarily go as far as say basic, because let's say comprehensive. So comprehensive blood work, metabolic profile, CMP, fatty acids, CBCs, those are essential. If you can get a little bit more specific and put some pathogens on there, viral loads are really, really super important. Sometimes people will do a lot of complementary testing for immune cells. I don't get too deep into that, but that's essential, Eric, number one. Because I don't want to start looking at the adrenals if I don't know, hey, does this person even have any iron going on? Are their size of the red blood cells really small? Is there a microcytic problem? So you got to start with that. Most importantly, you got to start with glucose. And, there's just so many studies that show that even a glucose tolerance test and fasting glucose doesn't correlate well with what's actually going on from a glucose handling problem. So that's where the questionnaires come into handy, and really sort of, look at a map and put all these things out there and bring all these equations in and really overlap and see how every little test kind of substantiates the other. So I would say, very, very comprehensive metabolic profile. And as you know, all of the thyroid markers that give you a full extent of a cellular problem with your reverse T3 and all the things that your listeners know about already, that has to be essential. That's where I would start with. But then getting into the blood work from, if we can get more hormonal stuff on there, getting a full hormone panel, and getting a lot of the metabolites if you can. You can get some free fractions of the hormone if you specifically ask for them. They're a little more expensive. But blood work is, that's our bread and butter for that. And then that's getting into the other stuff that we talked about from the blood, the urine, the saliva. And then that's where I have to have a genetic test as well.
Okay. So if somebody gets their comprehensive blood panel done, are there key markers on the blood work that you look at and say, this is a person who's probably working their way into an adrenal problem or adrenal fatigue? Are there specific markers that you look at obviously blood sugar, but what are those specific markers that really key you in that, hey, I probably have a person who might be working on adrenal fatigue?
Sure. Well, history first, right? I mean, the doctors got out of the habit of listening to their patients, right? And you could kind of tell, hey, I'm juggling 15 plates at the same time, and I'm exhausted, I'm burnt out, I can't focus, I can't concentrate, all the things that you hear with a thyroid patient, a hypothyroid patient. But great question. So inflammatory markers, you have acute phase reactants. So many people, you hear this, I'm sure both of you, I don't have any inflammation. My C-reactive protein and my sedimentation rates are low, so there's no inflammation. So we'll look for other signs of inflammation, uric acid, ferritin, those levels both being high, homocysteine levels being high or low, conversions being low. Those are things that I say, hey, there's got to be some inflammatory mechanism here. White blood cells being past those functional ranges, not those big, broad ranges that you see from the labs. Very low white blood cells, very high white blood cells, or higher than the functional ranges. Then you could look in the differentials and see what kind of what kind of process you may assume. High white blood cells, more bacterial based, maybe low white blood cells, viral based. That's just sort of a rule of thumb, but it gives you a better idea. And then of course your minerals, right? Because the adrenals are your mineral corticoids. So you're looking at your phosphorus, and you're looking at your magnesium, and you're looking at your chloride and sodium and potassium. A lot of people will say, oh, high sodium, high adrenals, low sodium, low adrenals. I think that's a stretch. And then of course, looking at your proteins and your globulins and your BUN and your liver enzymes to get an idea of how great of a digestive process do you have going on here. And that can really give you a great indication that, liver enzymes being elevated. That's another thing. So fatty acids and glucose, insulin resistant type patterns with high triglycerides, high LDLs, high cholesterol, low HDLs, high fasting insulin, high A1C. All those things are like, okay, now we're starting to really pigeonhole you in terms of an inflammatory, endocrine, immune-based thing that really point to the adrenals. And now I may need to evaluate further how impactful they are on the adrenals, and that's where we get into the other tests. Okay.
And so let me just kind of summarize some of those things. So first thing you're doing is you're definitely a comprehensive blood panel is an important thing. And I would think we all agree with that. That gives you your 30,000 foot view of, hey, is there dysregulation going on in the physiology here? And you look for key markers, inflammatory markers being huge. So you don't necessarily have to be diabetic. You could have elevated hemoglobin A1C. You can have elevated insulin levels. You can have uric acid levels elevated. You could have high or low homocysteine levels, high CRP. You could have high ferritin levels. And my ferritin for me, and that you guys may have your own ranges, but I don't really like to see ferritin much higher than 25 because ferritin is a tissue protein, not a serum protein. So if that value is starting to creep up over 25, we have to be considerate of the fact that it's an acute phase reactant, but that means that the tissues are being damaged, leaking the iron, that ferritin into the bloodstream. And as that ferritin leaks into the bloodstream, all that free iron leaks out. And it is all that free iron that creates all the damage. And then you talk about maybe fibrinogen, the conversion. If you see 25 to 125 OHD, that would be an inflammatory marker potentially for you as well, right? And high and low white blood cell counts. So you're looking at that 30,000 foot view. Do I have a lot of indicators that I've got inflammation going on? And then you say, hey, if I got inflammatory issues, it's going to impact my pituitary gland and my adrenal system, right?
Absolutely.
So can you tie in how that inflammatory mechanism might cause somebody to have adrenal problems?
Sure. So, the whole inflammatory system, the anti-inflammatories, the non-steroidal anti-inflammatories, cortisone, prednisone, those are all sort of derivatives of cortisol. And that's what the adrenals make. So there are anti-inflammatory signaler. And so if we have inflammation in the body, you can rest assured that those adrenals are firing. And then hence we come full circle back to an ACTH test to see Are the adrenals still mounting a response when they're being stimulated? So we know when there's inflammation, they're just being bombarded with stimulation. And so that's that in the nutshell, without getting too much more complicated than that. If we have inflammatory mechanisms going on in the body, that's the adrenals are sort of the coast guard to that process, and they sound the alarm systems.
Okay. Erica, questions?
Touching on the cortisone, do you find that, it might be a sidestep to that, that patients who have been on long-term, whether they have an autoimmune disease or they've been taking steroid injections in the joint, that often creates a feedback loop to the adrenals that could cause some adrenal fatigue?
Yeah, it's a great question. Those are some of my most difficult cases, right? Patients, because they do get on that. There's a great book. I forget. I have it in my desk over here. But it's I think it's long-term use of cortisol or cortisone, and ultimately there's mega dosing in those when the doctor's not in the know of the prescription that they give those patients. And that can really sedate, as you guys know, with even too much thyroid hormone. You see that feedback loop where the pituitary is just running ragged. It's already running ragged from the inflammatory cytokines, and that really does break down. And then it gives sort of a mixed message and shuts down processes, and I guess creates a whole Pandora's box of other problems. I don't know if that answers your question.
No, and I think I have found oftentimes that when somebody comes in and they're already autoimmune and they're already fatigued and they're on, some sort of, prednisone, that it can be very hard to try to manage, and get them to where they want to be, because they're, we're trying to fix one thing, but they're taking another thing that's creating a whole nother issue. And it can be very hard to manage some of those cases.
Yeah, I'm such a nerd, as I'm sure you guys like to dig into the research. So I go through a lot of those Dr. Lynch, conferences, and I just listened to the Susie Cohen one of the medical induced SNPs, and I kind of had forgotten about and gotten away from it. But I know you guys probably do it, where you have your pathway planner in front of you, and you can put the SNPs, the plus pluses and the plus minuses, and put a little layout of it. But then when you overlap that with the medications, hormone replacement therapies, proton pump inhibitors, acids, and steroids, and anti-inflammatories, and cortisone or cortisol, those shut down so many SNPs that aren't even plus or plus minuses in the first place, where you have sort of a slowdown of energy production on top of the processes that are stressing the body, that are causing the demand for them to increase, and that creates a perfect storm.
Mm-hmm. And I think it's important when the lab test comes back and you find that there's something going on adrenal based, a stress response to, it's not just let's throw a supplement at it, because that's just as bad as the medical model just throwing a pill at it. Taking that step back and saying, well, what's causing the stress response? Is it emotional stress? Is it physical stress? Is it, do we have a pathogen load? What's causing that inflammation that, really that's at the root cause? You can throw, just like the medical model, you can throw a supplement at it and maybe get the adrenals to normalize, temporarily, but then the minute they come off of it, they're going to have all these underlying things that are still going on.
Absolutely. And I've learned this from Eric too, is just what, of the 25 supplements that you're taking, what else can we give you that is going to make any difference? So, one of the things that I actually patented is the term stress footprint. So you have your ecological footprint, and the goal is to reduce that as much as possible. Same thing with your stress footprint. Your less is more. The more you can reduce and remove the stressor or stressors, the better the impact that's going to have, a way above and beyond any supplement that you can take. So, reducing your stress footprint ultimately is going to help your sympathetic and parasympathetic systems, and that's going to save the adrenals as well.
So you have a person who you've done some testing on, They've probably been somewhere else initially to get treated for adrenal fatigue. They've got all the symptoms of adrenal fatigue. They took the stimulants to stimulate their adrenal system, and they feel a bit worse. And you've seen this, we've seen this, and part of the reason is there is this process, and I want you to kind of maybe explain a little bit, where you can have cortisols in two states in the body, right? Cortisol and cortisone, right? The active form and the deactivated form. And so there are people that have tiredness, fatigue, but they're making plenty of cortisone, right? And cortisol. So can you explain how somebody who has all that symptomatology might take some adrenal stimulants and maybe potentially see no impact or actually feel worse, and how that might relate to this cortisol-cortisone balance? Does that make sense for you?
Yeah. I think that what ultimately is going on there is, number one, they're not really impacting what's driving and inducing cortisol, right? So they're tripping over dollars, I guess, to save pennies, in the sense that you're taking a couple of chairs off the Titanic by giving you a supplement that isn't addressing the overwhelm, the inflammatory mechanism, the inducers of blood sugar. And so that ties into some of the glucose and handling issues that we will get into in a couple moments. But that 11 beta HSD is that enzyme that helps oscillate between the cortisone and the cortisol. So the analogy I use is, Eric, I say, when it's cortisol, that's kind of the deployed troops. You have an army, and you just had a draft, and you deployed the troops and you sent them into the battle. Whereas the cortisone that's your active reserves. You bring them back from battle and put them into. So a lot of the times what will happen is that enzyme that does that may be working optimally. It may be trying to wring out the sponge as much as it possibly can to get whatever active troops into the battle, or it may not be working properly. You may see that it should be wringing out the sponge because there's very little, and it's actually down-regulated, and it's putting more inactive troops into into basic reserves. So that's when you have a couple of other concerns as to, okay, is this person's enzyme system and feedback loops and communications and cell membranes and messaging system working properly? But getting a supplement and trying to just close your eyes and hit the moving dartboard and not know all that stuff is ultimately playing Russian roulette. You're not going to know what's going to happen when you're not even getting to the root cause and what's inducing these things, let alone just trying to, magically over smart the body and give it a little supplement to fix the whole problem. It's very naive to think you can do that.
Right. So the cortisone could be in two forms, and you may be tired and think, okay, I just don't have any cortisol. I'm not making it. I'm in fatigue. And the reality is your body may just be deactivating it or keeping more of it in a deactivated state. So it's there, it's just not functional. And so what Joel is what he's saying to us is that you got to be really cautious or careful that if you just try and stimulate the system, you might have plenty of cortisol, but it's in a deactivated state. And even the things you do if your body's favoring that deactivated state, you may push that state a little bit further and not really get the results you want, right?
Yeah, absolutely. And that's where you get into, is there a cellular hypothyroid problem? Is the active hormone getting into the cell and spark plugging the engine to produce energy? And so you could have a whole pool of hormone that's ready to go. It's just not able to get into the cell. So you don't just want to willy-nilly take a supplement and you don't know that process, and you're just making more reserve. And meanwhile, the fire keeps burning stronger and harder.
Right. And so it may backfire. You may wind up pushing everything into fat, which is probably not what you want to do, right? Versus getting it in the usable form. So let's talk about things people can do. Like when you have somebody who's got adrenal fatigue issues, symptomatology, things that you may kind of give them to do. Obviously, we might as well start with obviously you want to take a look at their diet and their lifestyle. So let's start with diet. What do you do from a dietary and lifestyle standpoint to help these people before you start pushing or considering supplementation?
Yeah, sure. So, a lot of, you've seen it too, where you see like the autoimmune protocol, the SIBO protocol, the Candida protocol, where, someone starts to do that protocol, but then ultimately there's mixed messages that say, oh, you should do this, but this thing says you shouldn't do this. So which one do I do? Should I do it or should I not do it? So I come from that perspective, Eric, in terms of just there's common things no matter what's going on you should do, right? I mean, you shouldn't be crushing your carbs. I mean, whatever you have. And when I say crushing your carbs, I usually like to see someone, especially who has a problem with cortisol and has all of these hallmark symptoms, and their picture is in the book of the why are my thyroid symptoms not working, even, or whatever, then I like to make sure they're keeping their carbs, they have an antenna up to know how much are they doing on a daily basis. So start with that. Like, okay, let's just sort of take an inventory. How many grams of carbs are you taking? Well, how do I figure that out? Well, you got to get a little resourceful, well, that's a pain in the butt. Well, being exhausted and tired on medication and not working at your level that you could be working at and potentially being on disability is a pain in the butt worse. So, taking that sacrifice. So I sort of play that kind but loving cousin, you got to do this. So, taking an inventory first and finding out how much grams of carbs you're taking per day. Not all carbs are created equal. I like the idea of minusing the fiber from the total to get the net amount. But I like to keep someone between, say, 75 to 150 grams per day. And usually we want to have lots of fiber-based starches, not necessarily the grains, depending on that whole rabbit hole of going down there. And then I think in too many ways, patients are eating way too much proteins. And that can become a inducer of cortisol as well, because it will spike your insulin levels because you become gluconeogenic with too much protein. So the rule of thumb that I've done, there's probably a lot of different formulas, but I do 0.7 grams per pound of lean weight. So if you get someone who's 200 pounds and they got 20% body fat, and they're 80% lean weight, so they're 160 pounds of lean weight, I would times that by 0.7, and that's the amount of protein that I would recommend. And then typically I would go online to try to find a formula to find out what their metabolic rate is, how much calories they burn at rest, factor in their exercise values, and then figure out the difference with fats. So it kind of works out where, in a nutshell, without getting too complicated and not figuring out how to do that, eat more fats, eat less carbs, eat moderate amounts of proteins. That's what I would start with. Potentially reduce all of your grains, remove dairy, remove all your refined sugars. You're going to be doing that anyways because you're trying to get between 75 to 150. And that could be a really hard thing for people that finally lift that antenna and see, oh my goodness, I've been eating 300 grams of carbs a day. So we won't go in one foul swoop to 150. I'll ask them to titrate that down. So those are the things that we do right away, and those are the things that we got to get that person at least have a ballpark, at least be in the same ballpark of where you're at. I don't want you to be neurotic. And I found that I've made people take their glucose levels, take their ketone levels, take their pH levels, figure out how much carbs, proteins, and fats. And all of a sudden you got this inducer of stress while you're trying to figure out what's inducing your stress, right? So keep it simple. And that's probably the starting point.
Yeah, I think one of the things that we probably all agree on is simplicity in this situation is really best. And when we're trying to address diet, if you've got adrenal fatigue and adrenal fatigue issues and symptomatology, what we have a tendency to do is gravitate to things that are going to give us that boost. Coffee, things, those kind of drinks like Monster and with the little shot things, I don't even know what they're called. We have a tendency to crave more carbohydrates and sugars. And while you might think that that's the thing that's helping keeping you going, it is also the thing that's contributing to the problem. It's like trying to run your house on newspaper, like your house fire, right? If you have a fireplace, it's like constantly having to crumble up newspaper and throw it on there. It will cause you to get some energy, It'll create some fire in the fireplace, but it doesn't last long. And that's what happens with the caffeines and the caffeine drinks. And in the meantime, it's creating a lot of damage to the system. So I think we can all agree that a whole food, real food diet, if you want to keep it really, really simple, whole food, real food, low processed diet, regardless of the condition you have, is a great place to be, right?
Absolutely.
And if you keep it simple, you look at a plate, if half the plate's vegetables and the other half of the plate is got protein and some healthy fats on it, and a little bit of starch, you're probably in good shape, right? If it doesn't have any ingredients on the back of the package you got it in, it's probably a good thing, right? So dietary stuff is key. What are the other lifestyle factors you work on? I know one of those things is on your finger. Mine's on charge. So why don't you tell somebody, I know that's a piece. So what are you wearing and how do you use that to help you with impact?
Right. So the Oura Ring. So what it is it's a way to get an idea on the life load, right? The life load, basically. So life load is, I use stress as an analogy of a meat grinder, and it's making sausages and everything, all kinds of meats are going in there. All kinds of people just always associate, well, I don't have that much stress, so I can't have like an adrenal issue. We're not talking about psychosocial stress. We're talking about life load, all of the things that go into that meat grinder that impact you. So this can give me a good idea on my sleep score, which takes into consideration how quick I can fall asleep, how long I sleep for, how low does my resting heart rate go, and how long does it take to get there, and then that can extrapolate the deep amount of sleep that I had, the REM amount of sleep that I had. And that's where we get real healing, Eric. That's where your body's getting into a parasympathetic state. And that's where a lot of the healing takes place, from the lymphatics in the brain to the detox pathways to all of that. So, and then of course, looking at your heart rate variability, that gives us an idea on how much sympathetic overdrive you have. The lower your heart rate variability, the more sympathetic dominance you have. The higher your heart rate variability, the more parasympathetic. And it makes sense. Like if I have the ability to adapt, if I have the ability to go from one thing, get my heart rate up and be alert, and then bring it down very quickly, that's going to be someone who has good, tight control over their parasympathetic system. And we know that they're not in overwhelm. Whereas someone else who is tightly controlled by sympathetic, they don't have a lot of adaptability. They're just constantly driving their adrenaline and the noradrenaline, and ultimately a supply and demand problem is going to ensue, you know?
So can you talk about, let's kind of talk about how there's this kind of challenge for people who have adrenal issues, especially if they're in that kind of what we call fatigue pattern, right? Where they're chronically tired. They typically have challenges with sleep. And those challenges are things that even though they're exhausted, they may have a hard time getting to sleep. And then the other piece of that is they may have a hard time staying asleep. So can you talk a little bit how the adrenals and sleep, how those two things may interact?
Yeah, absolutely. So the best way to look at it is glucose is probably the biggest inducer of the adrenals, and how well we stabilize that. And there's so many things that go into it. But ultimately, the mindset is high glucose patients, insulin resistance. They're going to be more of a can't fall asleep type of person. Whereas you have low adrenal function or low glucose, and I don't necessarily see low glucose these days with patients that are older. Maybe the younger patients, but ultimately those cell membranes get so oxidized that those insulin levels aren't doing a great job, and they could have maybe low cellular glucose, but they still have high fasting glucose. Those are probably going to be the people that wake up a little bit earlier. So there's a bunch of strategies in terms of, as we mentioned, becoming metabolically flexible, where you're not burning that newspaper and having to keep crumpling it up. And the other thing that you were probably going to mention is that newspaper will create a lot of black smoke. So it's a dirtier burning fuel. it's less efficient, and it takes more energy to do it. And so ultimately the adrenals and the sleep system and ultimately our hormones that help us stay asleep and have good, deep, restful sleep are going to be influenced by our glucose levels. And that's sort of the easy way without getting too complicated, saying high glucose, more of a difficulty falling asleep. In general, there's a lot of other things that go into that. Low glucose, usually falling up earlier throughout the night. And that's probably the way I would look at that.
Erica, any question?
No, I think that's a really good point about the whole sleep thing. It's how we heal. Obviously, we know that the adrenals play a huge role in controlling that sleep-wake cycle and doing things, like blocking blue light and, screen exposure before bed. Those all, I think, play a role, and people don't think about that, as an aspect of, I don't understand how that could even affect my sleep, but it definitely plays a role in the way that, the adrenals function. Going back to the lifestyle stuff, a lot of patients who have adrenal issues are possibly overweight and they're fatigued, and they're told by their medical doctor, well, just exercise more. And so oftentimes they're pushing through and exercising and pushing themselves because they think that they need to just have more energy, they need to exercise. How do you find exercise plays into the whole adrenal fatigue aspect?
Well, it's the reason why I became the ninja. I mean, I overtrained myself, and that's probably combined with my life load, the debt, the stress, going through, graduate programs and studying and your nutrition and just the whole, got a final coming up. That's what put me over the edge. So what happens is there's a fine line with too much and too little, that life is the bell-shaped curve. And if you don't do enough of something, you may not be at the valley on the left. If you do too much of something, you're on the valley on the right. And exercise really fits into that bell-shaped paradigm very, very aptly, in terms of if you do too much, and that's a fine line. Like, if the mitochondria is not breathing well, and you have a lot of oxidative stress, and you have a lot of free radicals, and there's not a good cellular, thyroid and getting the activity of the cell working properly, and then you go and exercise and produce a lot of free radicals and overwork those mitochondria, then you're going to crash. And a lot of people do that. I have a subset, what we call an avatar of people that's what they do. That's how they got there. But on the flip side, training and exercising and short burst, high intensity exercises, like they call revving the car, where you're getting a good cortisol awakening response and doing a little bit of an intensity in the morning, can be really therapeutic for getting a spike of that cortisol level and getting that circadian rhythm reestablished, as well as helping the mitochondria. I mean, the mitochondria, after all, are power plants of the cell, and training effect impacts their strength. You sort of cull off the weakened herd and get rid of and delete the weakened mitochondria. So I wish I could give you a textbook answer on here's what it's got to be. Everyone's got to be this. Everyone's got to be that. Suffice it to say, I'm always a more of aggressive person in terms of, looking at the athlete that gets injured and loses their starting job on the field. They got to work harder to get back into their job, and they don't just sit on their butt for the rest of their life. I mean, their paycheck depends on them getting back into the game. But what they do is they do a graduated program. They start from a passive, just doing sort of basic, passive ranges of motion where someone's moving their foot for them. And then they get more into a aggressive weight bearing thing. So that's the same analogy I would use in terms of exercise. I mean, especially if there's that parasympathetic breathing thing and just getting some control over the muscles, but then slowly getting into more of you can have a long duration, short, low intensity thing. That's more of an advanced thing, or you could just have go for a walk and go to the end of the block and come back, get the oxygen, get the vitamin D, get those endorphins kicking, and so sort of figure out somewhere in between there. But don't throw the baby out with the bathwater and do nothing,
So I think what I hear you saying is that if you've got adrenal issues, you've got chronic fatigue, you've got to get some level of activity and movement, but you got to be cautious not to tax yourself. And it's a slow, gradual build up. And if the biggest challenge for a lot of people who have adrenal issues is not being self-aware. And as endurance athletes, I think for me, I know that, and for me, that was one of the big aha moments I had when I found out I had 2 autoimmune issues. I was like, how could I have, these issues going on? Because, I eat good, I exercise all the time, and I just was burning between work, study, research, up late, up early, exercising, doing all those things, work, family, all those things. You just kind of burn the candle on both ends. And so, what doesn't matter how you look on the outside, you still have to allow the body to heal and recover. And so exercise plays a role in health, but exercise can also play a role in the deterioration of your health if you're not careful, and especially as we get older. So Joel, we're getting close to the end here. So what I really want to do is I want to get a couple key things, I think 2 key things that we want to kind of finish up with. Somebody's got adrenal fatigue. They believe they're tired, they're fatigued, they're reading the blogs, they're listening to your information, maybe they've read or watched some of our information. What would you say are 3 key things that every person should do who thinks they're dealing with adrenal fatigue? What are the key things they should do potentially first before they even reach out to somebody like you or Erica or I?
Yeah, great question. So the first thing I would do is, do a trigger assessment kind of profile, meaning what are all the things that from a inducer of cortisol that you can identify. So, and these would be more the psychosocial things like job, relationships, finances, children, family, taxes, government, all of the things that, may be burdening you that leave a permanent on button, so to speak. Like you come to the car and you left the glove compartment open and you realize the battery's not starting. What's permanently on you? And take a inventory, because a lot of the times you can repurpose those things. So first one is taking inventory and seeing what you can do immediately to remove those, whether it's a physical removal or it's a psychological removal. Now that would be tying into the second thing. And people give me flack for this one, Eric, but the second thing I do is both gratitude and celebration. I have a lot of people that I work with that they are the train wrecks, but ultimately they would much rather be that than living in a third world country that doesn't have running water and, has no hope for the future, or has, knock on wood, a child in a cancer ward. And I hate to give these examples, but we got to be grateful for the things that we do have. We got to be grateful for, and that repositions these laundry list of inducers and triggers that you just identified. If I reposition the way that I think about this, ultimately that could impact my sympathetic and parasympathetic system. And that comes with gratitude. That comes with, I'm grateful for, my house. I'm grateful for my 2 legs, my heart that's beating, my wife, my children, my family, my creator. All of those things are super, super important. And then this would still be part 2, is the celebration. We don't take time to raise the antenna to things that are working. And these could be things as far back as, I remember when I was 10 years old, I did the flex arm hangs thing and I held it there for 90 seconds, Those are things that you got to identify, but more than that, like I know, like it usually takes me till 2 o'clock to fall asleep and then I wake up at 7. But last night it took me to 1 o'clock. That's a celebration. You got to start raising your antenna for things that are working, not things that aren't working. And combined with the gratitude, those 2 things will really reposition and lower your inducers of stress. And then lastly, I would say looking at the diet with the advice that we gave you, like controlling your carbs, not eating less, just eating less often, trying to get to a compressed eating window. I think every single person should have a 12-hour fast between the time they had their meal the night before to the time they have their breakfast the next day. That isn't a hard thing to ask. But I would be also looking at trying to assess your protein levels and see how much we're really a protein-fed nation that really creates more inducers of cortisol through insulin spikes. And then we don't eat any fat. We fat's the boogeyman. We eat nice MCT oils, coconut oils, avocados, seeds, nuts. We got to get more healthy fats in our diet. And with those three things, triggering, looking at your triggers, seeing what you can do, reducing them, physically removing them, or psychologically repatterning them, being grateful and celebrating. And these are things that you do daily. These have to be done daily. And then lastly, looking at the diet and seeing if you can control that glucose through controlling your carbs, controlling your protein, and getting more healthy fats.
I think those are all good things to consider. And, as you're kind of talking about, take stock of yourself, you become a little bit more self-aware of what's stressing you out. Many times like you said, we're not aware. I think you think about your iPhone, right? So you may look at your iPhone and go, man, my battery's dead. I didn't have it on that long. And then somebody comes by and says, well, the reason your phone battery's dying all the time is because you have all these apps open. And they go into your phone and they're like, yeah, you need to hit that button twice and then start closing all those apps you have open. Then you find out that there's 30, 40 things that you've been on your iPhone. And I'm doing it right now. I probably had 20, 25 things open. But that's how we are in our life sometimes. They're always on and always open, right? And we just don't realize how much energy those things pull from us. So I think that's a huge tip. Really take stock of what's going on in your life and think about you and your life and the stressors that impact you, like the apps that may be open on your phone that you're not aware of that are just stealing your energy. The second thing, gratitude and focus I think is huge. We get, and many people do who have chronic stress issues and health issues, get focused on the disorder or the disease and start to identify themselves as I'm a thyroid patient, or I'm a fibro person, or I'm a Lyme, or I'm this. And as soon as you identify as your disorder or as your disease, or I have chronic fatigue, you start to bring about what you think about, right? And so I think that's huge. Even though you might feel awful and might feel terrible, you have to look at the wins. You have to take focus and just shift it a little bit, right? There's a lot of terrible stuff going on. And if you watch the news, everything's terrible. But there's also some snippets of good stuff that goes on. And there's more good things going on than you're aware of. But if you start focusing on the good things in your life and around you, it's amazing how your life changes and how your health and the energy you get when you see and hear and focus on good things. So I think that's huge. I think we were at a seminar recently in Chicago together, and we both you wound up getting involved in that a little sooner than me, was that brain tap system, right? That really helps you with the meditation and kind of focus on nice things. I kind of was like, but I've since gotten that brain tap and used it, and I realized that, man, it does kind of really help me kind of channel my focus. It helps me with my sleep pattern. It really does change my day. It changes what I see on my Oura ring from day to day. And I'm still in that phase where I'm taking a look like, does it help? Does it not help? And I see that the days I use that, and especially if I do it 2 or 3 days in a row, my values on my Oura ring are much, much better. And then diet, I think, is huge. And I'd urge everybody to, before you reach out and spend a lot of money, on lots of special testing, and obviously we all think we have value in what we can offer somebody, and our time is worth something. Do the simple things like work on diet. I mean, that's key. It's not hard. Real whole foods. Keep it that simple. I think the protein, the carbohydrate thing is things to focus on as well, but keep it simple first. Eat real food, right? And if you focus on eating real food, things get a lot easier. And then start working on the things that are inhibiting your sleep, like Dr. Erica said. Get off your cell phone, get off the computer, get blue light blocking glasses at night. Make sure the shades are down, turn your Wi-Fi off. Do all these things that can help you get better quality sleep. And if you do those things, or you're working on things and you're not getting better, then it is really time to look for somebody who works in this world, okay? And then I'd say the last thing that I'd finish off, that I'll let you guys all come up with a little finishing point, is definitely, if you don't feel well, what you're feeling is real, right? So if you're seeing somebody and they're telling you that you just need to exercise more and eat less, and you feel like dirt, what you're feeling is real. They're just not aware of what's going on, or they're not helping you dig deep enough to figure out what's going on. I don't believe that anybody really wants to feel lousy and wants to feel tired. And so there's really something going on, and you just have to work your way through the process. And I think functional medicine and integrative medicine is probably the way to go to work on these functional issues versus that conventional model where they're more disease focused. So any final points, Dr. Erica?
I would just say, yeah, maybe getting a journal and writing down some of those things can be really, really crucial. Sometimes the neurological pathway of writing it down and actually reading it, and then having that book that on days that you feel terrible and you're wanting to focus on the negative, going back and looking at all the things that have come about, over you're trying to change your health. Maybe going back and looking at what was I like 3 months ago versus what I am now. People forget how bad they really were. And seeing your journey can actually give you that gratitude and know that you're moving in the right direction, which gives you hope. And, if you're really struggling with a lot of the things that, we've recommended here, seek out somebody who actually can dig a little bit deeper, because sometimes you need somebody who has a fresh mind to look at your case. Maybe it's something that you don't even realize that you're doing in your life that is really, really toxic, whether that's a relationship or maybe it's the products you're putting on your skin or your house environment. There's so many other things that play into it. Or maybe you have an underlying pathogen. Maybe you have Lyme disease, Epstein-Barr, SIBO. You have something that's creating that you can't see on the surface. And so having that fresh mind, I think is and seeking out the right person to look at that, I think is really crucial.
Fantastic. Joel, any final points?
Yeah, I mean, awesome points by you guys. The only other thing I'll build on Dr. Erica is that one of the things that we do in line with journaling is I have all my patients do a mission statement, and I have them tell me, okay, let's say we didn't have this, what would it be like in your life? Well, I would have more energy. Okay, well, if you had more energy, what would that allow you to do? Well, that would allow me to get out of the house, but I want that 10th one. Well, what would that allow you to do? And those are the bucket list items. Like, I want to go back to school. I want to go travel. I want to have deep and meaningful relationships. I want to give back to my community. I want people to get really specific about that, because then that's what, like Erica was saying, where you can tie your anchor or your lighthouse to that, so that now you can use that as a barometer. Am I moving forward? Because it is crucial that a lot of people don't see the little nuances that are better. And when you have something that you're not just floating around in the ocean aimlessly, you actually have a lighthouse to anchor to, and you could use that as a barometer. That has to be the things that you've forgotten about. Like, I ask people those questions and they're like, well, I don't even know. I haven't even allowed myself to think about that. Well, that's the problem. And that's because of biochemistry. That's because of cortisol hitting the frontal lobe. And now you're not really, planning and thinking as effectively as you could. But let's do some, frontal lobe bicep curls, so to speak, and keep that as part of the overall, this is what I want to get back to, and get back to that, because you can, and your body's very forgiving, and you're so close yet so far. It could be 1 or 2% away from getting 90% improvement. So that's the only other thing I'd add.
Fantastic. So Joel, why don't you tell everybody where you're at? I'll put your contact information, but if somebody wants to work with the adrenal fatigue recovery ninja, yes, how do they get a hold of you?
Well, thank you for asking. Yeah, I'm really excited. I've had a to-do list of making my website and getting it growing and getting it going. So I'm in the infancy stages, but it's called the Adrenal Fatigue Society. So adrenalfatiguesociety.com. We're rolling it out. I'm really excited to get that working great. We got a lot of free resources in there. I got a great free webinar in there that goes over a lot of the triggers as to why people aren't getting better. 5 keys to, quadruple your energy is what it is. It's a nice webinar. And that's probably the best way to get in contact with me. I do a lot of YouTube videos. So it's Your Adrenal Fix is my YouTube channel, sort of a play on the word fix. That's probably the best way to get in contact.
Awesome. Well, we appreciate you being on. I'm sure people will get a lot out of this podcast, and maybe we get you back on in the future at some point. All right.
Yeah, that sounds
yes. Awesome. Thank you so much for having me, guys. I appreciate it.
All right, everybody, take care. Thanks for listening. And if you've enjoyed the Thyroid Answers podcast, please go to iTunes or wherever you find this podcast and give us a little rating on there. I think 5 is the best, right? And so go on there, give us some feedback. If you have any questions regarding this specific podcast, put them wherever you watch this video, and we'll be sure to get back to you with some answers. All right. All right, guys, take care. Have a great weekend, and we'll talk soon.
Yeah. Bye.